Nelson Mandela's love for and by children is legendary. He is known to want to share his legacy and his cake with them. Nelson Mandela has a dream that here in Johannesburg there should be a hospital dedicated to the needs of Southern Africa's children because
only 3 children's hospitals serve this continent with its population of 741 million, 2 in Egypt and 1 in Cape Town. When compared with countries like Australia, Germany, and Canada, who each boast 19 or more facilities, this is not enough. Children of Southern Africa, too, have a right to be cared for and to receive the best medical treatment available when they are ill, and to receive treatment that compares with the best in the world. The Children's Hospital will be a credible demonstration of the commitment of African leaders to place the rights of children at the forefront. Nothing less would be enough.
For too long, the children of Southern Africa have been deprived of care designed to address their specific medical needs. A man's heart is the size of his fist. A child's heart is the size of a walnut. They are not little adults. They need specialist treatment in a dedicated environment.
I'm thrilled that the Nelson Mandela Children's Fund is establishing a children's hospital to complement the children's health facilities that already exist, but which have far too few beds to serve the children of South Africa, let alone those children in our region and beyond who are in desperate need of health care. This is a wonderful gesture by Madiba and the fund established by him for the specific benefit of the most vulnerable in society, our children. God be praised.
And now the dream is becoming a reality. Nelson Mandela himself, supported by his wife, Mrs. Graça Machel, the chairperson of the Nelson Mandela Children's Hospital Trust, recently dedicated the site of the hospital at a ceremony at the preferred site, the Wits Education Campus in Parktown, Johannesburg. The hospital is to be a state-of-the-art 200-bed pediatric, academic and tertiary referral facility, providing child-centered best quality medical services to the children of Southern Africa, irrespective of their social and economic status. This vision has been made possible through a unique private-public partnership with the South African government. It was at this ceremony that Mrs. Machel pointed out that the need for the hospital was conceived out of the personal experience of the CEO of the Nelson Mandela Children's Fund, Mzbongi Mokabela.
It was important for us to recall that this hospital actually was born in your heart. It was through your personal loss. It was through your personal loss you decided to offer millions of children who will be treated in this hospital to say, I lost my own, but no more children should be lost.
The Nelson Mandela Children's Hospital will house advanced diagnostic capabilities, 8 operating theatres, and is scheduled to expand to 300 beds. Its research, training, technology and equipment will make the Nelson Mandela Children's Hospital the most advanced paediatric facility the continent has ever seen. The support of and partnership with international paediatric specialists will make this a leading institution of its kind in the world. Everything, down to the design, will be child-centered. environmentally friendly, and will embrace Africa's indigenous approach to family care. Accommodation facilities are available for parents of children who come from afar and need to stay in the hospital for longer periods. Centres of excellence have been identified to be part of the Children's Hospital and will include haematology and oncology, cardiology and cardiothoracic surgery, neurosciences, a renal centre, an endocrine centre and a craniofacial centre. A strong focus on paediatric surgery and specialist ICU wards will ensure the tiniest of neonates will receive world-class care, thus giving them the best chance for survival. To come this far, to be able to stand on the preferred site, has been, in the words of the song, a long and winding road. For the past 5 years, Mr. Mandela and Mrs. Machel have joined Nelson Mandela Children's Fund trustees and officials in motivating, in driving the need for the hospital. The late Dr. Ntato Motlana led the team as pioneer and founding chair of the first steering committee.
It is important to learn from people who have ability to do something that is going to help the community.
International leaders and donors continue to pledge their moral and financial support to the hospital project. Queen Rania of Jordan is one of many who have offered their support to the project. Gauteng is the most densely populated province of South Africa and is also the economic hub of Southern Africa with excellent infrastructure. For this reason, the Children's Hospital is best positioned in this province, not only for the children of South Africa, but the entire SADC region and the African continent.
The concept of a new dedicated children's hospital is both an inspired and an inspiring vision. The prospects of this success will be an expression of Nelson Mandela's legacy to the well-being of children and will represent the highest point in changing the way society treats the defenseless and the youngest in times of illness. This step brings the country and the continent a little closer to meeting its increasing healthcare demands.
It is my pleasure to communicate our support for the development of the Nelson Mandela Children's Hospital. This hospital will benefit the children of South Africa and other countries within SADC, and thus put children first in health and development. We shall continue supporting the initiative as we endeavor to ensure sustainability and excellence.
On behalf of the university sector in South Africa, in Southern Africa, we are truly privileged that we can make available to this nation, to this region, the intellectual capital that resides within this region.
Government, medical professionals, donors, and parents alike all agree that the need is not a luxury, but a vital necessity that can no longer be delayed. This demonstrates that not only are we a nation that sleeps to dream, but that we are also capable of waking up to the demands of tomorrow. I thank you for your commitment to this wonderful initiative and ask for your continued support as we work together to take one step further in our efforts to changing the way society treats its most precious asset, our children.
The dream of Mr. Mandela, his legacy, is achievable now. You can, in his words, put the rights of children at the forefront. Your support can change history and will ensure that no child will be turned away because of an inability to pay.